After completing our structural examination, we have discovered on KCR patient that the most problematic region was the cervical region, specifically the typical cervicals. The diagnosis for Casey that we have discovered is C4, flexed, rotated right, side bent right. In order to treat this technique with muscle energy treatment, we are going to have our patient lying supine, and we will contact the patient's head in the same fashion in which we found the somatic dysfunction. But first, to locate C4, we can first find the protuberance of the occiput and then proceed inferiorly to the first bony prominence, that being C2. I will then count down 2 more segments to C4 and then come out to the lateral aspects of those articular pillars on C4. Now recall that the diagnosis was flexed, rotated right, side bent right. In order to engage the restrictive barrier, we need to extend side bent left and rotate left to the C4 vertebrae. So we will extend, side bend to the left, and rotate left until I have engaged the restrictive barrier at C4. Once the restrictive barrier is engaged, I will have Casey, if you could, just press against my thumb and try to come back to midline gently against my unyielding counterforce for 3 to 5 seconds and relax. I will wait for the post-isometric relaxation and then proceed with further extension, side bending to the left, and rotation to the left to engage the restrictive barrier. Casey, please come back to midline against my thumb again. Recall that muscle energy is a direct and active technique, and relax. We'll wait for that post-isometric relaxation and again further extend, rotate to the left, and side bend to the left to engage that restrictive barrier. And one last time for me, Casey, come back to midline. Good. 4, 5, and relax. And after proceeding with this 3 to 5 times, we will induce a final stretch by extending, side bending to the left, and rotating to the left. And after the final stretch, we will return our patient's head gently to neutral, and we will retest in the same initial fashion in which we found the somatic dysfunction by coming to the lateral aspects of C4 and inducing lateral translation in a neutral position, as well as an extended position and flexed position, all of which are now moving symmetrically. So our muscle energy treatment for his somatic dysfunction was successful.